Omicron has left us with more questions than answers, but it also is different, and it is spreading through our communities in a way that is different. People are getting infected with a much smaller dose of the virus. It spreads to the people that we are closest with, the people we live with, the people we socialize with. The puzzle is coming together around Omicron. We are learning more about how fast it spreads, how infectious it is, and it is very clear that it is increasingly transmissible. You're 10 times more likely to be reinfected if you have been infected before and are not yet vaccinated. But some of the things that we are learning is that particularly people who have 2 doses of vaccine on board, who have been fully vaccinated, regardless of how long ago that was, if you have any symptoms of COVID-19, you really must assume that you have the virus. If you are not fully vaccinated as well, you are more likely to have more severe illness. The best thing for a healthcare worker, please do go and get tested. The encouraging trend that we are seeing around the world is that for most people who are fully vaccinated, illness continues to be mild. Booster doses are also providing added protection to those who are at highest risk, which is why we're continuing to follow the approach of 6 months based on interval from your dose 2. Every day, the case numbers have a lot to do with how many people are tested. We now have an online reporting tool for rapid testing, and that will give us a sense of how many people are reporting that their rapid test was positive. That's just another piece that helps us put together the picture. We are seeing higher levels of absenteeism as people become sick. So we are learning more. Every day, more of these pieces about Omicron come together. What we don't yet know for sure is how severe this illness will be as more work. They may not stop all transmission, but this week we are seeing that hospitalizations in critical care are holding steady. We are once again in a new phase of our pandemic, and we must continue to evolve and adapt. Despite all of our best efforts, we are not going to prevent this wave, but we do all need to continue to do our part. People will become ill with this new infectious strain, despite all we are doing. Things that we can do, including upping our mask game, making sure we have a good quality 3-layer mask, or using surgical masks or KN95s, and getting vaccinated. We know that that is what is protecting us the most right now, whether it's your first dose, your second dose, or when you're invited for your booster dose. We need to give each other a booster shot of kindness once again. All along, we know that the daily numbers are not reflecting everybody who has COVID in our province. And that's why we went with 7 days a few months ago. We know that for people who are not vaccinated, they still have a much longer period of time and shed more virus. Looking very carefully at the data from the U.S. and the data that we are now accumulating, and I talked a little bit about this last week, now that we see that a smaller amount of the virus can bind more strongly to it's all about risk and mitigating the risk, because we know that some people will shed for longer, and seeing if there's ways that we can have healthcare workers, for example, with very mild or asymptomatic cases working in some aspects of healthcare. We're starting to see absenteeism from Omicron, mostly with mild illness. As you know, all healthcare workers are vaccinated. So somewhat different situation than what they were seeing in the U.S., where their vaccination rates are lower, so another part of it that helps preserve our health, our workforces in those.
Has decided that they are going to allow those who are terminated due to not being vaccinated to return to work. Is BC considering either of these options to help protect the healthcare system? And also,
we are looking at fitness for work for people who have mild illness. This has been a reality through this pandemic, where if workers aren't vaccinated, for example, and and you have workers transmitting to each other, that businesses have to close because they don't have enough people to care or to carry on their business. But these are things we want to prevent, and the best way to prevent them is by making sure that everybody in your setting is vaccinated. It cannot be the same as what we have been doing all along, and we'll need to work together to make sure that we're appropriately notifying people about what the risk is. I still know that the people we get infected and the people we infect are our close contacts, our social connections, our family. Those we're closest. Have in place the infection prevention and control guidelines in our healthcare settings, in all healthcare settings. And that guidance is robust. 95 respirators are widely available and being used, as are elastomeric half-face respirators in ICUs, in COVID wards, in those higher risk settings now. It definitely is Omicron. We know by our whole genome sequencing that has really taken off. It's about, I actually haven't seen the data for today. There's a lot that we don't yet know. I'm hopeful that the things that we're all doing collectively, we really, our strategy has been, since we made the decision around booster doses, is to protect those most at risk first. And we do have good, strong vaccine effectiveness. Protection from hospitalization is still very strong, in the 90% range. So that's, it's, I can only just say it again. If you're due for a booster dose, get it now. And more people will be invited to book their boosters, and more pharmacies and larger clinics are coming online in the next.
Receive your notification to book. The sooner you book, the sooner you get your booster dose, which is important for you, and that you should go ahead and do it. So I don't think.
Please, why the province didn't make it mandatory for teachers and school staff to be vaccinated, as government did virtually with every other public sector job in the province.
So it really is about continuity planning and making sure we have the best things in place. This is not a delay in start to what am I trying to say? No, I have always said that I think that every person who works in our school system should be immunized, and that's important, but it is up to the employer, which are the school districts, to bring in those policies. Having said
1,000 unbooked booster appointments, could those unused appointments go to people who want those boosters right now?
About 200,000 people that have been invited. Yes, the appointments have been titrated for the invites. That means they are available, and we have been able to move other people up, and we are doing that more rapidly. But it also, again, reflects that balancing that we have to do, in that longer than 6 months probably gives longer lasting, stronger protection. As if you're coming up to your 6 months, you will be getting your booster within the next few weeks. These are ramping up quickly.